The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Macular degeneration. It's an eye disease that can severely impair our vision. Living with it every day often means a loss of independence. But fortunately, innovative low vision aids can help people keep their lives in focus. As tap water becomes increasingly dangerous to drink, purification systems are growing in popularity with just the touch of a button. For those who smoke, simply quitting is not always that simple. But with the availability of nicotine substitutes, a healthier life can emerge after the smoke clears. Are you desperately trying to lose those excess pounds? An answer to this question can be found in a simple and delicious program. Just add water. All these topics are coming up next on Today's Health. This program is brought to you in part by Pulse Data International, Moen Incorporated, SmithKline Beecham, and Medifast.
In an age of beepers, faxes, and cellular phones, it can often be difficult to just get away from it all and relax. The way we live has more impact on our health than any other single factor. I'm Faith Daniels, and this is Today's Health. Stress, diet, exercise, and other lifestyle choices can be controlled, or they can control us. The key to maintaining good health may lie in how well we manage it all.
I used to be very handy with a hammer and a nail and chisels and so forth. I was very handy mechanically. I could fix things, I could take things apart and so forth. Gradually I found out that I couldn't see the slot in the screw.
It could be happening to you or someone you care about. For millions of people over the age of 60, an eye disease called macular degeneration is severely impairing their vision, taking away the ability to do everyday activities such as reading the newspaper, signing checks, or even recognizing faces. People with macular degeneration often feel they are losing their independence and privacy. They often feel forced to rely on others to be their eyes.
The macula is roughly a 4 millimeter area of tissue that is used to do all of our detail vision. When we look at the letters on a page or the letters on a word, we're using our macula to observe that. When we know what's happening to the side of us, that's our peripheral vision. A person with a normal, healthy macula can do all of the things that we do from day to day: sign checks, read a newspaper, look at photographs, identify faces in a grocery store, that type of thing. A person with macular deterioration or macular degeneration loses all of those abilities to some level.
This is...
That's Julie.
That's Julie or Erica? I can't see.
Julie.
I had to rely on my wife for many of the things that normally a person can do easily by himself. If a small item like finding a keyhole, I couldn't find a keyhole to open the door, to unlock the door. She was actually, in many little ways, she was my eyes.
If you or someone you know lives with macular degeneration, it's important to know you are not alone. Pulse Data can help you find specialists, support groups, and low vision tools such as the Smart View. This low vision tool is specifically designed to help people with macular degeneration to read and write. Smart View is an adjustable magnification system that can allow people to read small type, view photos, sign checks, and even work on their computers.
I'm active in a lot of organizations, and as a result I have to do a lot of reading, a lot of writing, check writing, letter writing.
The vast majority of people with macular degeneration can greatly benefit from these video magnifiers.
Vision loss is not much different than any other form of loss that a person might experience. You take away some of the skills, some of the abilities, some of the freedoms that we have with our vision, and we sort of take those things for granted. And when you lose those abilities, this feeling of inadequacy brings about some form of depression on many people. Not everyone, but many.
With this machine, I feel like a normal human being. I don't feel handicapped in any way. I don't have to depend on anybody to read a paper to me or a print or anything like that. I feel that I can do whatever anybody else can do.
Having low vision does not have to mean a total loss of independence or privacy. With the proper treatment, support groups, and the right low vision tools, people can gain control of their lives and maintain their independence.
It's no surprise that with the rise of contaminated tap water, more families are installing filtration systems. But what kind of system is best for our health? With all the health problems it can cause, why is smoking still a habit of many? Quitting cold turkey would seem to be the smartest choice, although not one of the easiest. So perhaps a commitment to ease the cravings first is the right approach. These topics next.
Water, water everywhere, but not a drop to drink. Does that phrase from classic literature describe the drinking water situation in your home? Many people are rightfully concerned about their tap water, and they're looking for ways to ensure that it's safe.
Do you drink the tap water in your home? Years ago, that may have seemed like a ridiculous question, but not anymore. According to a Gallup survey, over 75% of the people in the U.S. are concerned about the taste and smell of their drinking water.
Consumers need to be aware of what's in their water, whether it's from their tap or whether it's purchased bottled water, primarily for health reasons, especially if there's children at home. The majority of water from the water treatment plant is safe. Some of the contaminants that might be found in tap water include chlorine, which is used to kill harmful bacteria. On the other hand, it can leave a bad taste or odor, which is offensive to many people in their drinking water. In addition, there can be lead, which might leach into the water system from older plumbing systems. And then in extreme cases, there might be some harmful microorganisms that get through, such as Cryptosporidium, Giardia.
Over a third of adults in this country have turned to bottled water, but this can become expensive, and it often lacks cavity-fighting fluoride, which is added to public drinking water. This can leave teeth vulnerable to decay and bacteria. It's hard to beat the convenience of water from the tap, and for more peace of mind, some people use filtration systems like jugs for their tap water or a system-installed purification filter. A water filtration system, like the PureTouch filtering faucet from Moen, contains a replaceable solid carbon filter that lets you know when to change it. It can remove a high percentage of chlorine, lead, and potentially harmful microorganisms. At the same time, the beneficial fluoride remains intact.
The solid carbon filter allows us to reduce a higher percentage of the contaminants, and in addition to that, it allows us to reduce the Cryptosporidium, Giardia, and lead, whereas the granular filters primarily remove chlorine, taste, and odor. In the PureTouch faucet, the filtered water and the unfiltered water never meet. There's two separate water channels and two separate outlets. And the clear advantage to that is that it maintains the integrity of the system, and you're never getting unfiltered water in the filtered water channel.
When you consider that 70% of the human body is made up of water, it becomes very clear how important this vital fluid is to our health. Fortunately, filtration technology is helping us purify the water at the tap so that we can once again safely drink our drinking water.
Lung cancer is a serious threat to men and women, but in a very disturbing trend, it has become increasingly dangerous to women. Between 1974 and 1994, lung cancer deaths among women more than doubled. What do we know about this silent killer, and how can we fight it?
Sometimes a killer can escape unnoticed, and when it comes to lung cancer and women, this may be the case. While lung cancer kills more women than breast cancer and ovarian cancer combined, it doesn't have nearly the same recognition among women. Currently, lung cancer claims over 160,000 lives each year, and although men account for over half of these deaths, the alarming growth rate of this disease in women may soon evenly divide the death toll. One major factor for the startling increase is due to cigarette smoking. Smoking is attributable to over 85% of all cases of lung cancer.
Most women in the United States don't know that more women die of lung cancer than they do of breast cancer.
There are two ways a person can greatly increase the chance of avoiding this type of cancer: stop smoking or never start. Educational and awareness programs aimed at teens can help them make the decision not to smoke. But what if you are already a smoker? There are nicotine replacement substitutes like over-the-counter Nicorette gum or the Nicoderm CQ patch that can help ease the cravings.
Nicotine is the most addictive chemical. So that once you start smoking and gradually increase your dose of nicotine every day, you're chemically addicted.
There are nearly 4 million smokers that attempt to quit. With the availability of over-the-counter nicotine replacement therapy, the number of smokers who have successfully quit in the first year has increased by 20%.
And here you can see there's a white shadow. It's actually round, and you can actually see a level in it. That's
Doctor did a chest x-ray, and the x-ray showed cancer in my lungs. And the doctor told me that I had to quit smoking that day. And I said, how am I going to do that? And he said, well, we'll give you some help. I'll recommend the patch for you. And we'll see if that'll help you quit, but you have to quit smoking.
By far and away, the most important one is that the smoker must decide that they're going to stop smoking. If you don't decide that you're going to quit smoking, nothing else is going to help. So that's by far and away is the most important thing, is to make sure that there's a firm decision to quit smoking. And then once you've made that decision, you can say what other products are available to help me stop smoking. And the nicotine replacement products are probably the best that are on the market for helping people stop smoking.
Anybody that I know that says they want to quit smoking, I always tell them, try the patch, because it worked for me.
Lung cancer is a vital health issue that deserves more attention and awareness than it has received. Important tips to avoid this killer are to never start smoking, and if you do smoke, quit. Every day you are smoke-free counts towards a healthier life.
You lose some, you gain some back. It's this yo-yo dieting that plagues many people trying to shed those unwanted pounds. But what if a program existed that enabled people to stay focused on their weight loss goals? Well, coming up, we'll introduce you to this over-the-counter program and several stories of success. Stay tuned.
It's an unfortunate fact, but being overweight is far more than just an appearance issue. It can also be a serious health problem. Excess body fat increases your risk for many diseases. It's also a disease all by itself, obesity.
There's an epidemic in this country. It affects nearly 1 in every 3 persons, over 97 million people. The disease is obesity, and if your body weight is over 30 to 40% of your desirable weight, you fall into this category.
Obesity is a chronic disease. It is a disease that cannot be cured, and yet it can be controlled. Obesity is multifactorial in origin, and therefore, in order to properly treat obesity, we need to use different methods of treatment. Obesity has many health risks, including diabetes, hypertension, and coronary artery disease, and it increases morbidity and mortality.
2 ways used to quantify obesity are the rule of thumb equation or the body mass index, BMI. The rule of thumb equation for women is 100 pounds for the first 5 feet and add 5 pounds for every inch thereafter, then plus or minus 10%. The rule of thumb equation for men is 106 pounds for the first 5 feet and add 6 pounds for every inch thereafter, then plus or minus 10%. Using the BMI chart, first find the appropriate height in the left-hand column. Move across the chart to the right to a given weight. Then follow that column down to the corresponding BMI number at the bottom of the chart.
Well, Pam, with your height at 60 inches and your weight at 168, your BMI is 32. A BMI in the range of 25 to 29 is compatible with being overweight. A BMI of 30 or greater is consistent with obesity.
It's clear Americans are very weight conscious. Last year, we spent more than $300 billion on diet books, diet meals, classes, drugs, and other weight loss aids. Unfortunately, medical researchers put the direct and indirect costs of obesity at more than $100 billion annually. And weight-related conditions are responsible for more than 300,000 preventable deaths each year.
Obesity is multifactorial in origin, and it has many ramifications. People suffer physically, but as well as psychologically and emotionally.
There is a real need to change the public perception of obesity. It is not simply an appearance problem. It is a dangerous disease that can be prevented, treated, and successfully managed.
There's a limit to the amount of information we can give you in just 30 minutes, but the internet is virtually unlimited. So visit our website at vstar.com and find out more. Losing weight is a difficult challenge. Keeping the weight off can be even more challenging, but it can be done. Obesity doesn't have to continue to threaten your life. It can be treated and kept under control.
If you had heart disease or cancer, you probably wouldn't dream of trying to treat it yourself. But for various reasons, many people who are dangerously overweight try to deal with it alone. Even if they successfully shed pounds, they seldom manage to keep the weight off.
Obesity can be difficult to treat because many people relapse. In other words, if they lose their weight, often the weight is regained.
Taking in high quality food and sticking to a proper diet is so important when you're trying to lose fat, because you're trying to incorporate exercise into that program. And your body is like an engine, and if you're not taking in enough fuel, then you're not going to be able to perform adequately.
I've decided to lose weight primarily because of health reasons. I'm concerned about my parents having health problems that were weight-related, and both of them died at early ages, and I thought if I'm going to try to prevent some of those, I need to start now.
There are countless numbers of diet programs on the market. Some are good and some are not. Some promising systems were once only available through doctors, clinics, and university research studies, like the MetaFast program. This program is now available over the counter and uses a multifaceted approach that includes a low-fat diet, regular exercise program, and Take Shape nutritional supplements.
When you cut back on calories, you're also cutting back on nutrients many times, and it's very difficult to manage what you eat. And taking a supplement such as Take Shape is a great way to know that you're getting enough.
It's very frustrating trying to lose weight and keep it off. It's especially around the holidays, it's so easy to fall back into your old patterns of eating if you're not careful. I'm hopeful that this program that I'm starting now with MetaFast will be easier because I'm not going to have to plan what meals I want to eat during the day. I just know that I'll be eating the shakes, and it'll be so simple to fix them. So this way I'll be able to drink a shake for breakfast, have another one for lunch, one for snack. Really will not have to do much preparation. It'll be easy because water's almost available anywhere I am.
What we do with the MetaFast programs is we ask that people drink at least 64 ounces or approximately 2 liters of fluid, preferably water, every day in addition to their supplements.
People can and do successfully manage obesity. If patients can arrive at their target weight with new, healthier habits, there's a good chance that this time they will be able to manage their weight better.
Although at times it may seem like dieting is the national pastime, successful weight management isn't so common. We found some people, though, who not only brought down their weight, they're keeping it down. Let's listen to their stories.
The effort to lose weight most of the time was back and forth, like a roller coaster ride. I'd lose the weight and gain it back, try another diet, lose the weight and gain it back. So it was just like a roller coaster ride.
It was very frustrating for me to gain weight and not be able to really lose it or keep it off. Sometimes I would fluctuate a little bit, a few pounds. I would go to the gym in spurts. Then I wouldn't have time with work or school. And it's very frustrating to me not to be able to keep that under control.
Waist first.
And when I was in between clients or class and work, I would tend to eat whatever was available. And a lot of times, especially in today, it seems to be fast food. But I've tried different books, consulted them, and it's just really hard to keep up with any kind of program where you have to have routine, because I just don't have routine in my life.
My physician led me to the Medifast program. By me going to the doctors on a regular basis because of the diabetes, we discussed it and went over it, and in fact recommended that I do the program. My initial feeling when I started the Medifast program was kind of nervous. I was undecisive. Should I do a fasting program? Should I do something else?
I heard about it through my gym. I'm a massage therapist there, and one of the physical trainers told me about it, and she said it was a great program. It tasted really good. I have a problem with taste. If it doesn't taste good, I don't stick with it. I've incorporated the program into my life quite easily. I grab a couple packs in the morning, make sure I have them in my gym bag or in my car, take along a container with me, and then between classes or the gym or work, I just shake one up and drink it. I can take it as a meal placement or snack.
I began to see benefits with the program right away. The first week when I went back to get the examination, I lost 4 pounds in a week. So that definitely kept me motivated.
My spirits are definitely higher now. I feel better about myself. I feel like I've eaten something that's good for me. It makes me feel good. It tastes good. What more could I want?
I started out at 240. I'm down to 165 now. I love the results that I've gotten from the program and what I'm getting now. I feel a lot healthier. The exercise plays a key role. My body is getting toned now. So overall, I feel really good.
Obesity is a dangerous and costly disease that impacts both individuals and society in general. It can be treated, prevented, and managed. There is support and help, and there are solutions. If you have the courage to take the first step and ask for help, you'll be that much closer to a healthier lifestyle.
Sometimes it seems as though we're running through a gauntlet of diseases and conditions that can rob us of our precious good health. That's why it's so important that we actively manage our life choices and give ourselves the best shot at maintaining our health. I'm Faith Daniels. Join us again next time when we get right to the heart of matters concerning your life on Today's Health.
For information about macular degeneration and SmartView, contact Pulse Data International Incorporated at 1-800-921-2161.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.